Hello, my name is Patrick Long and welcome to your Catapult Benefit Minute. This is part of our series, Top 10 Costs. Where does our money go? Today's subject, number 9, behavioral. So this is a growing expense on your plans and a growing expense for your people. Let's learn a little bit more about it and what we can do to improve it. Mental and behavioral health have been a huge front page issue since COVID and coming out of COVID. We're finding a lot more about the prevalence, the breadth and depth of mental and behavioral health issues, how they impact our workforce, and how they ultimately are paid for by our plan and our people. So I'm not going to go into the deep details between mental and behavioral, but suffice to say that mental health is primarily focused on your psychiatric state. Behavioral health takes that into account, but also your body and what you're putting into it and what you're doing with it, how you behave. Psychiatric care, eating disorders, family and marriage counseling, substance and addiction treatments. These are all part of what comes under behavioral health costs for your plan. So this is obviously a growing category of claims, but there are also anxiety and other things that are not charged in your plan, but are prevalent in your workforce, and you can address those as well. Let's talk about some of the solutions. So here are some of the people that help: psychiatrists, psychologists, counselors, social workers, and specialists, especially around addiction counseling. People who are addicted to alcohol have a much better chance of coming out of that successfully if they're counseled by someone who was also addicted themselves. Similarly with opioids, benzos, heroin, and other strong drugs. Having someone who's been there before as your specialist, as your counselor, means you have a greater chance of success. So those are some of the people that help. Those are some of the big problems that are hitting your plans. Let's talk a little bit about what your status quo plan offers to counteract these forces that are in our workplace right now. I would say they're very limited by what we see. They're very localized. People go to the first person that they see in their plan from their PPO card, and they can be very costly because they're episodic and they happen over time. It's not like a surgery that happens once. It happens all the time, and so the costs can really be high. Hero treats this very differently. We know that anxiety is more prevalent than ever. More than 50% of your workforce or typical workforce says that they're feeling very anxious. That's something that needs to be addressed and can be with zero out-of-pocket telehealth and behavioral health. Oftentimes people can't wait or won't wait till they get to see a doctor. They want to talk to somebody right away, especially younger workers are very used to using their cell phones to get anything they want, from an Uber ride to dinner. If they can tap to talk to a professional, especially a PhD or a master's degree or a specialist in their addiction or their anxiety or their troubles, that's highly valuable. Also the cost, to make that zero out of pocket, so there's no barriers to this. The ROI is there. If you treat people where they are, when they need to be treated, your plan savings will manifest itself over time. And this is evolving. I wouldn't say that we have all the answers right now, but we are open to data-driven solutions. And so what we're looking for coming out of COVID is what's working, where's the data, what's not working, let's avoid that. How do we rewrite our plans so that we can deliver the solutions from the professionals to the right people at the right time? Often from a nurse navigator, an app, telehealth doctors, all of these things can be put together into a comprehensive solution for behavioral health. Thanks for watching.